Aaron Traeger. I'm a pediatrician with Advocate Medical Group, and today we're going to talk about postpartum depression and the so-called baby blues. Now, congratulations. You know, you had a baby, and this baby's here, and it's going either exactly the way you thought it would be, or your baby's a little more fussy and squirrely, and it's not going the way that you thought it would be going, and for some reason you feel, sad about this. Okay. This is a really common thing, surprisingly, and very few people talk about it. So when you come into the doctor's office, when we come in for your regular baby checkups that happen when the baby first leaves the hospital, we're going to ask you about your mood, and we're probably going to give you a little questionnaire, a little form that we want you to fill out that talks about how you're feeling, what's your mood been like, are you overly emotional, do you ever think about hurting yourself or the baby or things like that. It's not that we're accusing you of that or anything like that. Everybody we give those forms to, because what we're looking for is postpartum depression, which is very, very common in women that have had a baby. And the reason why we talk about this so much is because it's normal for a lot of women to feel this way, but we don't want it to affect you. We don't want it to affect how you raise your baby and your overall bonding experience with your child. Like I said, this should be an exciting time, and this is something that you should be, feeling really good about. One thing that I want everyone to realize is that this is a very, very common thing, and the reason why people don't talk about it is because they feel embarrassed or ashamed or something like that, or that maybe that so-and-so, that people feel like they're crazy or being labeled or something like that, and that is totally not the case at all. Now, most of the time, just talking with us, your pediatrician or your obstetrician, and letting us know, hey, look, I'm not feeling up to the way I normally do. You're feeling a little down, you're feeling a little sad, emotional, things like that. Talking about it, counseling, things like that can be great, and we can help you find resources. We can help you identify somebody in your family that you can confide with, to help this experience go a little bit better. And then if that's not the case, if we're still not getting anywhere, there is a good place for medications for people that have postpartum depression. And a lot of breastfeeding moms will tell us, they'll say, oh, I'm breastfeeding, I don't want to do any medications. The medicines are safe and effective in situations where they're absolutely needed. But we're not going to know whether or not this is something that would be useful for you unless you talk with us about it. So we really want you to feel comfortable talking with us and letting us know how you feel. And if we don't ask about it for some reason, tell us how you feel about this. And when we fill out the little forms, in our office, the postpartum depression questionnaire, answer it honestly. And it's a good starting point for us to be able to say, let's talk about this, because, ultimately, we want to make sure that you and your baby have the bonding experience that you need.